Bismillahirrahmanirrahim. Actually, it's just not a talk, it's just an introduction about my forum. That's the Lipid Forum of Pakistan. Why we have made this forum? And what is the epidemiology of the lipids in the Pakistan? This is very alarming situation over here. We would like to know about the pattern, risk factor, and public health implications of the lipids. In Pakistan, significantly high prevalence of dyslipidemia is present. Is about, if you can say, certain studies show that it is about 98%, rather no more than 95%. From 65 to 98% of the population may have some form of dyslipidemia, especially in one study found 95 to 2% in the general population, with 87 in having low LDLC. As we know that HDL, LDL, triglyceride, and cholesterol all are the independent risk factor. So dyslipidemia means any one of that one is disturbed, is included in the dyslipidemia. Multiple studies have confirmed very high rate of dyslipidemia across Pakistan, both in general population and those especially in the diabetics. Despite the elevated cholesterol being a rather common occurrence in Pakistan, very few studies have been conducted in Pakistan on the hypercholesteremia, which show the lack of attention given to this lipid disorder. A study conducted by the Basir et al. Across Pakistan has reported an alarming high prevalence of dyslipidemia of about 96%. Hypercholesteremia across Pakistan has been reported to be highest in Punjab and Lower Balochistan, with a prevalence of 41 to 6% to 22% respectively, but the lipid disturbances across Pakistan is very high. Prevalence, it is very high. Urgent call is required for controlling and for assessing the problem and the management of dyslipidemia. And if you know that, as far as the urban and rural ratio is concerned, urban is being catched by rural population as well, just because of the lifestyle modification. Another study conducted in 2001 by FATMI at all the prevalence of any dyslipidemia was reported 68% across the male and 79% in the females, means the females are more suffer from the dyslipidemia as compared to the males. Overall, almost 7 in the 10 adults in the urban South Asia have been some form of dyslipidemia, and predominant subtypes were very low HDLC and high TG. This high prevalence is due to lifestyle changes and a poor diet, high in saturated and trans fat, physical inactivity, and urbanization. Studies suggest that the globally elevated total cholesterol affect about 39% of the population. And the associated risk factors with dyslipidemia are cardiovascular risk factor, hypertension, diabetes mellitus, stroke, and other problems as well. Which lead to what? Burden of the healthcare system, contribution to non-communicable disease epidemics, and economic cost is high because of cardiovascular disease increase. Awareness and screening is the main problem. Low awareness in general population, limited access to screening in the rural areas, and role of primary care physician is very, very important, because the patient initially go to the primary physician and they must know how to screen the lipids and how to manage that one. So the national guideline is still not here. I hope in due course of time, national guideline about the lipid will also be published, which on that will be make a committee from the Forum of Lipid Forum of Pakistan to make the national guideline, and for which ask and include all the stakeholders of the society. STEP is a WHO developed standardization but flexible framework to countries to monitor main non-communicable disease risk factors through questionnaire assessment and physical and biochemical measurement. It is coordinated by national authorities of the implementing country. Why we have formed the Lipid Forum of Pakistan? Because we know that the lipids have been taught in each and every conference, but the separate sessions of that one is not there. So I thought, okay, why should not we have the own forum, like we have the Forum of Hypertension, as the Pakistan Cardiology and other forums as well. So why not we have the special forum for the lipids to address? And why we have addressed? For that I talk with my friends like Professor Mansoor Ahmad, Professor Isaac, Professor Firoz Mehman, Professor Nawaz Lashari and others, and we decided to establish Lipid Forum of Pakistan to address especially the lipid problems. And for that matter, only when this idea was floated, the Adbul company come in to support us unconditional in all the academic activity of the forum. And for that matter, I am thankful to the Mr. Kashif Riyad and his team for supporting the Lipid Forum Pakistan in the initial and difficult phase of Lipid Forum Pakistan. Why we think and our objective to provide the platform for the interaction of community services, NGO with Lipid Forum Pakistan for prevention of cardiovascular disease, provide the platform for the interaction of national and international society for lipids, provide the platform for the interaction and all disciplines of the medicine for prevention of cardiovascular diseases, provide up-to-date guidelines for detection and treatment of lipids, to promote the ways and means of training for medical and paramedical personnel for detection of the lipids, provide the platform for interaction of community services, NGOs with Lipid Forum Pakistan for prevention of cardiovascular disease, and provide the platform for research in clinical and basic aspects of lipids. You know, they provide the platform of the interaction of media, general public, and expert on the lipid. And we know that each year in the world there are Lipid Day, which is celebrated on 10th May each year. Like we did the Hypertension Day on 17th May. The Lipid Day worldwide is established on 10th May. We started our journey from the 10th May of last, and we inshallah continue with this one with the help of my senior, my colleagues, my juniors, and the farmer associate who have the to promote the lipids in the country. Thank you very much.